Hello everyone, I wanted to give you a quick little video on some osteology terminology. What that means is that I'm going to break down some of the terms in which we use to describe different bony structures to help you better understand why we use those words, and maybe it'll help with a little bit of memorization too. So let's start with the word condyle or knob, and also epicondyle. Epi means upon or on, and since we just learned condyle means knob, it just means on the knob. And then we're going to talk about the word foramen, which means hole. If we are going to use this term for multiple holes, then it would be foramina. So let's see some examples. If we look at this view of the anterior knee, we can see that on our femur, this knob over here is our medial condyle, and then we have our lateral condyle. When we have another extra bump, or it's more of the upper portion of it, these are called epicondyles. And let's take a look at a hole, a foramen. Here is an inferior view of the skull. So down here is the big gigantic hole in which the spinal cord would transmit. So this was called the foramen magnum. Now let's take a look at the word meatus, which means canal. So here you could see a photo of our ear, and that place where most people put in their Q-tip, this is our external acoustic meatus. It's external because it's toward the outside, auditory because it's referring to the ear and hearing, and meatus means canal, and you could see that canal right there. Next term is going to, well actually let me pull these up together. We have these two terms that mean depression. So fossa is going to mean more of like a shallow depression. So kind of think about when you have a plate in front of you, how the upper portions kind of move up. And an example of this would be something called the infraspinous fossa. So infra meaning below, spinous referring to the spine of the scapula, and fossa is referring to the depression on this bone. You could see how this part is moving up like it would at the edge of a plate. And here is our example of a sulcus. So this is the proximal or top portion of the humerus, and the depression lies right in between here, between our greater tubercle and our lesser tubercle. So this is actually called our intertubercular sulcus. Inter meaning between, tubercular referring to the tubercles, and sulcus referring to a depression. Or we can also use the term groove here to describe what a sulcus is like. And then we have our last term of depression. This is the deepest type of depression you can have. If we look at the orbit or the socket for our eyeball, you could see this space right in here is termed our superior orbital fissure. We've got an inferior fissure as well. So this is the superior, means like the higher one. Orbital referring to the eye socket, and fissure referring to this deep, deep depression in here. Now let's look at the terms tubercle and tuberosity. So they both mean bump, but they describe different types of bumps. This one here, our tubercle, is like a sharp bump. So you see this bump is the greater tubercle, and here we would have our lesser tubercle. And then for tuberosity, I tried to find a great picture of this, but it was really difficult to see the quality and the detail in what a tuberosity looks like. It's more of a perforated or roughened type of bump. And then we have the word facet. This is our site of articulation. So our example here would be looking at our vertebrae, and up here you see a smoothed out area in which is going to meet with another vertebrae. So basically it's the smoothed out area in which will meet up with another bone to form a joint. Our next term is crest, and if you put your hands on your hips, that would be the iliac crest that you are feeling over there. So this is our hip bone. Look, here's our femur here, right? So if you put your hands on your hips, you'll feel like a bony ridge there, and that is your iliac crest. Our next term is ramus, And ramus means branch. So we can use the example here in the mandible where it is moving up and branching over to reach the upper portion of, or we should really say the lower portion, the inferior portion of our skull here. Now let's talk about two terms, process and spine. So process is going to be a projection or an outgrowth of bone. We have two examples here, the acromial process, which is that highest point on our scapula, right? And also the coracoid process. So look how this bone has grown out and is sticking out. And this is really so muscles can attach to these areas. Whereas when we look at spine, it also means a projection, but it's going to be more of a thorn-like process. So now we're looking at a posterior view of our scapula, and this is the spine here. Or of course, you can think of the spinous process on a vertebrae. So like we see over here, this is a lateral view of our vertebrae, and you see the spinous process is sticking out. So that is it. Please let me know if you have any questions at all on this osteology terminology.